Hi, I'm Dr.Moolya, gynecologist from Unihealth Specialty Clinics, Kondapur. So, we usually get a lot of patients who are 40, 42 years and they want to start planning their family at that time. So, the most common question that we get is, Madam, can I get pregnant because I am 40 years? A simple answer to that is yes, you can get pregnant. But now, if we break it down, what are the things that you have to do to make sure that you get pregnant successfully and have a healthy pregnancy and you deliver a healthy baby? So, first, now, because you are 40 years, yes, there are some things that we have to take care of and we have to be very vigilant about. So, those things are first is we do not have a lot of time to give you like a person who is in their 20s or 30s. So, we have to be a bit more proactive and a bit more vigilant. So, what do you have to do initially? You have to get your basic blood test done. That is, on the day two of your period, you have to check your hormonal status and also your antral follicular count. That is a scan which is done on the day 2 or day 3 of your period cycle to know the egg count that is present in your ovaries. And you also have to get a blood test known as the AMH test, which will tell you your ovarian reserve. How is it? How are your chances of getting pregnant? And along with this, you have to also check your tubes, whether they are open or whether they are closed or they have a block. And you also have to check the status of your uterus. How is your uterus? Do you have any other complications like a fibroid, a polyp, or endometriosis, or your uterus is healthy enough to carry your baby to term? Okay, because getting pregnant is one part, and carrying the baby to term and delivering a healthy baby is another part. Then, along with your tests and your basic body hormone tests like your thyroid, your hemoglobin, and your blood grouping, your sugar levels, being at 40, sugar levels are one of the most important things that you do have to check to make sure that you will have a healthy pregnancy and you can get pregnant easily. Now, along with your general routine tests, you also have to get your husband test because your husband also has to know how his sperm quality is, how his general health is, which will in fact in turn again affect his sperm quality. So usually males above 40 years, we do see that they have a bit of decreased sperm count or decreased motility. So depending on that, your husband has to get a semen analysis done. Mind it, the semen analysis should be done within 3 days of with 3 days of abstinence. And semen analysis, he also has to get his sugar levels, thyroid levels, and his general checkup, general whole body checkup done. And once everything is clear with the both of you, then we'll have to go for the further steps in planning the pregnancy. Yes, definitely you can try naturally, but the period of when you will try naturally is shortened. So maximum you can try naturally with the tracking of your ovulation and tracking of your cycles for a period of 2 to 3 months. And within 3 months, even if you're not successful in getting pregnant following all the guidelines and all the precautions and the timing, then it is advisable to go to the next step, which is after the evaluation you have to try and for the IUI, that is the intrauterine insemination. This is the next step. Usually what we say, if a person is above 25 years or above nearly 30 years, you can say, we'll say you try 6 months of or 1 year of trying naturally. If not, then you go for the IOI. If not, then you go for the IVF. But being above 40 years, we give 3 months of grace period for the spontaneous conception. And if not within 3 months, then we'll give another 2 to 3 cycles, not more than that, 2 to 3 cycles of an IUI trial. And if that is also not successful, then yes, IVF is the best option for you that is there, because in IVF we can also see your genetic material of your husband's sperm and the ovum, and we can also do a testing that is known as pre-genetic implantation testing or PGT, which will tell us how your embryo is before the implantation. So we can make sure that the baby that or the embryo that we implant in you does not carry any chromosomal abnormalities that can be detected prior with the pre-genetic testing. And then after you do the pre-genetic testing and after you do the embryo transfer and everything, and if you get pregnant, there are certain extra medications that you have to take in pregnancy, so your baby will have a good blood supply, and you will be a bit at a lower risk of developing chances of BP in the pregnancy, that is which we known as preeclampsia or sugar in pregnancy. And you do have a higher chance of developing sugar and BP in the pregnancy, and there is a risk of also the baby growth being a bit less, which is all taken care of as a holistic approach during your pregnancy time to ensure that you have a safe and sound pregnancy and you deliver a good term healthy baby, and you'll also have a good delivery, either normal or cesarean, depending on that, and you have a faster recovery post delivery. Thank you.